Good day, judges. My name is Lian Hui, and today I would like to introduce our MediQ, which is an automated patient triage and management system for hospital. So our project is aims to improve hospital triage efficiencies using a smart and automated system. Before that, let me start with a small product preview. So our system will begin with vital sign measurements, including temperatures, SpO2, and also the heart rate. So the data after collect will send to the cloud, where the triage scoring system will classify patients into three categories, which is critical, urgent, and non-urgent categories. So this will allow faster and more accurate patients' prioritizations. For more details how MediQ works, let us dive into this full workflow of our system. So at first, when the patients arrive in hospital and patients can measure their vital signs at the kiosk. So once measurement is taken, the data will transmitted to the cloud and stored in the Google Sheets. So the patient is then can complete their registrations using app sheets by entering their symptoms, medical history, and also the personal information. So based on the collected data, the system will determine the triage level and automatically assigns a queue number, which is sent to the patients via WhatsApp. So this have shows how the result is taken from our system. So when our fingers placed on the MediQ, the major vital signs will display on the LCD screen. So at the same time, the data is recorded in AppSheet for monitoring by the healthcare staff. So finally, the patient will receive their queue number and triage status through WhatsApp. So this demonstrates real-time data processing and also the communication. So this is our developed prototype called MediQ. It is designed as a compact and user-friendly kiosk. The system integrates sensors, microcontrollers, and display into one unit, making it very suitable for hospital or clinic use. In addition, our system is aligned with telemedicine's applications, which enables remote monitoring and early assessments without requiring immediate physical interactions, which is especially useful in rural areas or during high patient volume situations. So therefore, our system does not only improve triage efficiencies but also supports the future of digital healthcare and telemedicine. So next, we'll show a demonstration of how the system works in a real scenario. The patient interacts with the system, measure the vital signs, and completes with registrations. After a short demonstrations, I would like to show the accuracy testing for our sensor. So for the MX30102 sensor, the average error is approximately 4% for the heart rate and 2.5% for SpO2. So for the temperature sensor, the average error is around 0.5%. So this result have indicates that our system have provide a reliable and acceptable accuracy for healthcare monitoring applications. Hereafter, safety is also the very important considerations in our system design. First of all, users are required to sanitize their hand before use to prevent the contaminations and to ensure the hygiene. Second, the kiosk is built using wood material, which act as an insulator to reduce the risk of electrical conductions and also prevent heat transfer to the surface. So lastly, all the sensors are properly covered to prevent the electrical shock.
Hi, my name is Julie, and now I would like to continue with the highlight of this product. So, this product MediQ, it is portable because it has lightweight, so it is convenient if you want to bring it around. Next, it is independent of power supply. So, if there is no power supply, the battery operated system can last for 6 hours. It is important for a medical device in terms of battery operated. We'll move on to sustainability on MediQ. As we know, for all medical devices, we like to use it for long-term, manageable, and upgradable design. So, for MediQ, it is easily replaceable because the sensors that we use, for example, LCD screen, ESP32 thermometer, are widely available in the market. So this can help to reduce the long-term maintenance costs and also electronic waste. Next, MediQ is a reusable system which is able to use repetitively. It is environmental friendly and cost effective for long-term use. It is also ideal for community and public healthcare settings. Lastly, it's a cloud-based software. So we use a built-in using Google AppSheet and Google Sheet, so it can help to support every more updates and feature upgrades. And there's no disruption to core functionality during updates. So this is how we sustain. Let us move on to the cost of this product. So as for the left-hand side table, you are able to see the list of products that we use and the cost. So we use up a total of 993 ringgit 70 cents. As on the right-hand side, it is the operational cost, which costs up to 411 ringgit. So with all the costs that we have seen in the previous slide, you may wonder how much we would like to sell. So in this slide, I would like to share with all of you how much we would like to sell. So in the first year, the total estimated cost is around 1,400 ringgit. So the proposed selling price for MediQ is only 1,600. Even though we earn less, but we would like to save more humans' life, and it is important for medical device to be cheap because it can be affordable for everyone. Now let's see the difference between MediQ and also the triage system that is already available in the market. So the triage system that is available in the market is Curix. So as we can see, MediQ is way more cheaper compared to Curix. For Curix, you're only able to measure for temperature, and if you want to input other measurement, we need to key in manually, which may cause mistakes. However, for MediQ, we are able to measure the temperature, SpO2, heart rate. Even though there's a lot of sensors and hardware we are using, however, it only make up of a very small, portable, and light kiosk. Because our target market is public clinic, rural health posts, and mobile clinics. So if it's light, it is convenient for us to move around. Not only that, as I mentioned earlier, when it is battery operated, it is able to last up for 6 hours, so which suits our target. Lastly, we have achieved these three objectives in this project. First is to reduce the patient waiting time through real-time screening. Next is to improve triage consistency using a rule-based system and vital sign threshold. And lastly is to enable a better clinical decision-making by displaying real-time patient data via AppSheet. So through this project, we also have contributed 3 SDG, which are SDG 3, 9, and 10. And that's all from us. Thank you.